Hey, Dr. Caitlin.
Yeah.
Can I live without my gallbladder?
You can, but you're going to need to support your body because that organ is actually extremely important when it comes to digestion and your health. So what that gallbladder is going to do is it's going to concentrate the bile that your liver creates, and it's going to release it at the right time and the right amount in order to break down fats. So now that you don't have a gallbladder, your liver is still making that bile, and it's going to release it a little bit at a time, constantly into your gut, whether you're eating something that has fat in it or not. And then when you do eat a meal with a lot more fat in it, you don't have enough concentrated bile to break it down properly. So you might experience things like gas or bloating, diarrhea, and some studies have even shown certain mental health issues 5 years down the road after getting that gallbladder removed. So taking some kind of gallbladder support like gallbladder complex, ox bile supplement, making sure you're getting beets in your diet are all some ways to support your gallbladder, but you do need to be diligent since you don't have that organ.
Thank you.
So in respect to post gallbladder removal diarrhea, this video actually had some good information, but let's talk about it. So the function of the gallbladder is to release bile into your GI tract to help absorb fats. And yes, the gallbladder does have some job at concentrating your bile. It essentially pulls excess water out, so the bile that it does end up releasing into your GI tract is more concentrated and can more effectively digest fat. This is a study out of China that looked at post-cholecystectomy diarrhea. Quote, anywhere between a 2% to 50% chance of having diarrhea after surgery, which is an insanely wide range. Almost all of this diarrhea resolves or stops 6 weeks after surgery because your body has figured out ways to excrete the bile more effectively and or reabsorb it in your colon more effectively. And so I do around 150-ish gallbladder surgeries a year and ask every single patient at their 2-week post-op visit, do you have diarrhea? I would say on average, maybe 5 of those 150 people tell me, yes, I do. And now we always follow those patients out further and say, hey, if you continue to have diarrhea after 6 weeks, please let me know and I can give you medicine to make that better. Nobody has contacted me for that in the past 5 years. So are those patients just toughing it out and I don't know? I hope not. I hope they would reach out to me if they're having a problem. But in general, if you're going to have diarrhea, it's going to be worse immediately after surgery because your body is still figuring out how to readjust to having no gallbladder. So there was good information in that video, but I would be hesitant to believe anybody who is selling you a supplement that says you need to take this after every single gallbladder surgery removal happens. It's just not honest.